Hello, everybody. My name is Helena Pirttiniemi, and I'm coming from Homeopathy College, It's Health, from Finland. I'm a very proud Zomeo user. I like to use the software to help me with the patients. And today I'm going to tell you a little about accidents and injuries and how to use Zomeo with that. Let me tell you a little story. I have a nice day. And I have a patient who is going to tell me he had a very nice day and he was in a little bit hurry. And oh no, oh, he falls down. Accident happens and there are injuries. Oh no. The physician highest calling, his only calling is to make sick people healthy, to heal, as it's termed, says Hanmel. So the patient comes to me and asks for help. And I'm beginning to ask, what happened? Bike accident. And the patient is going to tell me physical trauma level 1 symptoms. After accident, I got ecchymosis, bruises, sore flesh. Maybe I've got a broken bone or fracture. And the patient goes on our emotional trauma level 2. After accident, I take a look around. Did somebody see me? Are they laughing at me? I'm full of grief and anxiety. And the continuing story, patient tells me about mind trauma. I'm fear of falling now. I will never go back again. And I don't mind. Actually, it doesn't mind. I have these bruises, but I don't want to talk about them. Actually, he's got a shock. He's refusing to answer about these questions. And for me, I've learned in homeopathy that homeopathy is about removing a barrier. Health is not just the absence of symptoms. It is a state of harmony between mind, body, and spirit, says John Henry Clarke. So, I'm thinking about this story, my patient. The patient has got trauma at one, and the other one, and the third one. So all levels, and there are barriers to remove. In homeopathy, there are these levels. This physical level, when there is this accident, this acute trauma, when there's happened injuries, bruises, and the patient says, open air ease the pain. And there is soreness of flesh, ecchymosis, and then there is this very, very peculiar thing, avota, angry when obliged to answer. And then there's this next level, emotional level. The patient is telling me, did anyone see me? I'm full of grief. And maybe it could be shame or some other feeling. The patient has also the mind trauma, shock. I will never circle again. That's it. Don't mind. What is the most peculiar thing in this patient's story? The most strangest symptom in this case for me was injury. About talking about the injury, how it hurt and what about it. The patient doesn't want to talk about it. That's very queer to me. And in homeopathy, we are trying to find these symptoms, what are a little bit weird or awkward or strange. And when I go to Zomeo, there are these boxes in the left. You took a code prescriber, and I'm starting to think what the activity is now. Is it decreased, increased, no change? And then there is this avota, angry about these questions. And then immediately Acute prescriber tells me few names of the acute remedies. On the right side, you see arnica, the first one. I know arnica somehow, so I'm going to study a little bit more about that. But there is also, for example, nux vomica. What about how is it possible? Is it possible to be injury remedy? I look at the keynotes for Annika. Trauma or injury remedy, perfect. Painful bruise, perfect. Sore feeling, perfect. This would be a very good remedy. Acute injuries, affinities in Arnica, blood vessels. Modalities, worse bruises, shock, scarring, labor, overexertion, motion becoming heated. And then a better one when the pain is easier in open air. That's perfect. My patient said it helps when I'm in open air. The bruises are not so bad. Cold bathing, uncovering, changing positions. These are the main things we are looking for the patient to say to confirm the remedy. And then there's this mind, peculiar symptom, anger alternating and lamenting when obliged to answer. Very good choice, I think. What about more? Trauma. This is acute. Injuries has happened, yes. Ecchymosis has happened, bruises, and this sore bruised sensation. And in Arnica, you have this sensation as if bed is too hard. Modalities are all pains worse on motion, fear to touch, wants to be left alone. My patient doesn't want to talk about it, just give me the remedy. Sounds correct. And the soreness of flesh with sharp or sticky neuralgias. That's good. That's not good for the patient, but that's good to find in the symptoms. Bruised pain over whole body with the bruised sensations and the anxiety, fear of death. Very good choice. This could be the choice. But I want to make it sure. So I go to my Zomeo and I put some rubrics quickly because it's very quick situation. The patient wants to get help immediately. Doesn't want to talk about the symptoms, but wants the relief. So I put some rubrics there. Pain, sore bruised, answering refused, emotional upset, and so on. And there are over 1,000 remedies. Oh my God, there are so many remedies. What shall I do? I look at the first ones. They can be very good options. And there is arnica. There are also opium, ledum, and nux vomica. And then what I want to do, I want to compare them. I put them to add remedy to remedy extract list. And then all rubrics of these 4 remedies are there to study. So I can see about the anxiety in mind in this acute situation, how they differ and what are the same things in these remedies. This is very helpful to find these symptoms here. So I'm looking at nux vomica, affinities, mind, nerves, respiratory organs, and modalities, worse, early morning, motion, cold, drafts, wind, and uncovering. And the pain will ease and they will be better. Free discharges, rest, moist air in evening, warm room covering warmth, heat. The patient said open air ameliorate, so not so much, so not so good. And the patient in nux vomica situation is very chilly, and the open air is making worse. Cold in general is making worse. So nux vomica may be not the best remedy here in this situation. And there is this photo when the convulsions are in nux vomica, the patient is stretching like this picture in pain. Nux vomica keynotes are spasms, sensitiveness. The patient is sensitive, soreness of flesh, and the nervous system is affected. And chilliness are the 3 general characteristics of this remedy, nux vomica. Nux has the most violent convulsions, so this is very good injury remedy. This is a good to remind. Worse from lies this draught of air. Cramped state, can't relax. And why Nux situation person can't relax? because the person is hasty, looks malignantly at anyone who asks him anything without answering. That's why the remedy was avota in the first Someo slide. Every harmless word offends. So it's not so good to talk about because it might offend me. I'm doing something wrong. So it's a different way saying a no or refusing to answer. Nux is always troubled with thousands of little things. His mind is constantly hurried from one thing to another until he is tortured. So maybe the bike, he was in a hurry. There are many good things to point Nux vomica in this case. And what about ledum? Affidini joints, small joints, capillary circulation, blood, nerves, and the modalities are worse in warm, also in injury, motion, night, and walking. But very strange, better cold, holding feet in ice water, pain improved by cold applications. And in ledum state, the person is cold and chilly, yet heat of bed is intolerable. I'm chilly, but not good at the bed when it's warm. Ecchymosis, when you have this black eye from a blow or contusion, this remedy is better than arnica. Very good to know. Is the eye hurt in this bike accident? Maybe ledum would be very good too. And ledum keynotes are amazingly helping. They are helpful and comforting to external injuries. Useful for sprained and twisted joints. This is good to remember in this accident. And main remedy for mottled puncture wounds. Closely associated in traumatism with arnica and hypericum, especially for injuries from stepping on tasks, puncturing with needles. And very special in this remedy are parts cold to touch, but not subjectively cold to patient. And that is the same as in arnica. So they are very near, arnica and ledum. Limbs and whole body painful as if bruised and beaten, as well as arnica. In this ledum state you are restless, you cannot reflect steadily or work quietly. On the other hand, cross, he retired into solitude and almost weeping, longed for death, says the provings. They are very good text in Someo for provings in our Materia Medicas. And the last one to compare was opium. Affinities, mind, senses, nerves. Yes, they are affected. These levels, modalities, worse. Emotions, fear, fright, heat, hot bath, cold, uncovering. And better, the pain is easier when it's cold and constant walking, open air. Maybe in this case too, but not so much. And this fear of the fright remains. This is very, very big in this case in opium, but not maybe not in this case in the bicycle injury, the accident. Opium keynotes ailments from excessive joy. For birthdays, you can get sick, but especially fright and anger, also shame. All ailments are worse and they appear after these emotional or mental ailments. Ailments from fright, the fear of the fright remaining, and there's always great thirst. And the pulse is slow with slow, stertorous respirations, exceedingly red face, extremely profuse perspiration, and also convulsions, because there is something going on in the body. Face pale and face flushed. Useful for emotional shock. And very peculiar in this remedy is painlessness in all ailments. But in this case, when the bicycle person was falling, patient has sore flesh pain. this is not the remedy right now. Painlessness or in all ailments or complaints of nothing wants nothing. So arnica would be picked first aid this bicycle injury. Arnica, C30, 2 pills per day for 3 days. You can do this prescription to Someo and print it to your customer or send it by email. And you can also tell the patient arnica ointment could be used twice a day. And what would we expect to happen after this arnica remedy is taken? Prognosis. Pain would be, I hope, much less. So the physical level 1 would be easier. Grief and anxiety away. So the level 2 emotional level will heal. And I hope so much that the fear is gone and the patient will be cycling soon again. And always in homeopathy, when you choose the remedy, you have to tell your patient, don't take it if it doesn't help. So, if there is no improvement by 3 doses in these 3 days, stop. As this means the remedy is incorrect. As you see, I was comparing 4 remedies and there were 1,000 remedies to pick up. But these are the best one, I think. When it's not improved, so choose another remedy that better matches the symptoms after 3 days. So change to Lidium or to Nux C30. And when you have this arnica, you can tell the patient what is the main thing in our acute arnica cases. It is for bruising and damage to soft tissues, such as skin and muscles. So if there's a broken bone, you have to see the doctor and to be mended the broken bone. So there are other remedies for broken bones. Arnica always slows bleeding and reduces swelling, promotes healing, helps with shock, and reduces the risk of infection. And it's ideal as first remedy for broken bones, fractures that cause bleeding and swelling into the tissues, but you have to go to doctor and use more remedies if it's broken, like symphytum or hypericum for nerve. But arnica is very good for the start, for the first aid. And if you buy arnica tips for more, when you have arnica at home, you can use it also acute overstretch situations. Arnica might help you also when you have started a new hobby, like the girl is jumping and stretching and muscles get maybe a little bit overstressed, or you can rake and you can clean and you get muscles you never know you have be sore. So arnica situation in acute cases could be also when your muscles cry for help. These are the tips and the thinking about acute injuries. So I would say thank you homeopathy and thank you Someo software to help us these difficult situations in acute conditions and also in chronic situations because, for example, arnica can be used very, very nicely in chronic situations as well. Thank you so much and have a nice day.